Hi, welcome to Come Talk TV. I'm Lisa Chayon. Today I was going to talk about the plight of asylum seekers in Israel, a topic very close to my heart. But on the way to work I heard a very disturbing interview with Nissim Mishal, with the head of Rambam Hospital in Haifa, talking about the absolute crisis in healthcare and particularly in hospitalization in this country. He was saying that at the moment hospitals are operating, some at 140% of capacity, many as much as 300% capacity, and this is simply unacceptable. There are simply not enough hospital beds, and we are talking about the entire country, and we're talking about not only in winter. He was asked specifically, is this a specific problem around winter and more illnesses in winter? And he said, no, we are operating at this level throughout the year, and if we have more illness in winter, the situation is exacerbated. But we cannot function, and the healthcare system is on the verge of collapse. Yes, we've heard this before, but it sounds very serious. And when we talk about hospital beds, we talk about the entire infrastructure of the hospital, from the support staff, the nursing staff, the doctors, the equipment. There are simply not enough beds in our hospitals today. He was talking about patients on ventilators, up to 5 patients at a time, ventilated, waiting for beds in intensive care, and there was simply nowhere for them to go. He was talking about a patient arriving in acute abdominal pain who was not allowed to get out of the ambulance because there was simply nowhere to put him in the emergency room. These types of situations are happening every day. In the developed world, the number of hospital beds per 1,000 people is 2.5. In Israel today, we are talking about an average of 1.9 hospital beds per 1,000 people, well below the average for a developed country. This is a crisis, and sadly, because our coalition was not working, because there was huge conflicts within the governing coalition in the last 2 years, and before that, our government has not been able to come up with a solution. Yael Jermain was the health minister. She was from the party Yesh Atid. Do you think she did a good job? Do you think she did what she could under the circumstances? Who will be our next health minister? Where is the budget for this health crisis going to come from? Please write into our Facebook page. Join with us on our Twitter feed. Post your suggestions. How do we solve the healthcare crisis in Israel? Who do we vote for? Who's going to fix the healthcare for us? We'll look more into this issue. We're raising it here today. Post your suggestions on Facebook. Be in touch.